White of Community Updates is unable to be with us today. So we send our prayers of healing to Michelle. Today we have our guest, Cara Thomas. Cara Thomas is Regional Manager of Prevention Services, Gambling Prevention Coordinator, Chair of the Faith Based Initiatives at Detroit Wayne Integrated Health Network. Um, and substance use disorder, correct? All right. And she has 20 plus years. As a matter of fact, when I was saying 20 plus years, she said 22 years. So
That's
22
correct.
years
Yep.
in prevention, substance abuse prevention, treatment and recovery. She is also the coordinator and manager of the contractual and coalition services provided by 30 plus prevention providers
Yes.
annually. Cara and I, we went to church together at Tabernacle Missionary Baptist Church, where Cara used to sing with her mother and her sisters in a singing group, and she is a beautiful soul. I am so excited to have Cara to join us today. I saw her at a prevention event,
That's right.
and I invited her onto the show as well as Michelle, and we are excited to talk to you today about prevention, which is this is the prevention National Prevention Week. Is
That
that
is
correct?
correct. Yes.
Yes, it is from May 7th through the 13th. And so we're
Yes.
excited to talk to you about prevention because I think a lot of times, Cara, we don't really think about, all the elements that prevention includes. And so
That's
when I
right.
was reading through your resume, it includes community, faith,
Yes.
individual, health, so many
Businesses.
areas of
Oh,
our lives.
yes.
And so I just want to ask you, how did you even get involved in prevention?
Well, I started out working with the Detroit Health Department with a department called the Partnership for a Drug-Free Detroit.
Okay.
Um, After having worked for about 2 to 3 years um, with Ford Motor Company, I saw that it was something after having a heart for our community to pick something that I uh, really had a heart to do to work with our communities, which is one of the things that we encourage through the work that I'm doing today. But that's where I started doing this work in prevention back in 2000, November 2000. That's why I say it's coming up on 22 years that
Wow.
our work through our partnership for Drug Free Detroit had prevention is doing a lot of work there that led me on to working at staying within the Detroit Health Department, led up to me being the prevention coordinator, ultimately, before we integrated our services with Detroit Wayne Integrated Health Network in 2014. So
Oh,
that's
okay.
why you see from the years of working with the health departments and different coordinating agencies, as we were called at that time, some 16 years ago, we were had to come together as a county. So we now, in the Detroit Wayne Integrated Health Network, there are 43 cities that I have the opportunity to engage with to do prevention services. And as you said, there are 30 plus providers that are out across the region, but there is so many services that we have to fulfill with those areas that we see gaps in that cover substance use prevention, treatment, and recovery.
Wow. So this week, as I said, is all about celebrating possibilities
That's right.
for the National Prevention Week. And so tell me, how important is the National Prevention Week in coordination with the type of things that you do?
It's very important. So throughout each year, and this is the 12th year for celebrating National Prevention Week, we are each day there is focus around mental health and substance abuse efforts because we know once I mentioned how we integrated back in 2014 was because of the mandate from our government stating that the services that we do in substance use disorder fell up under a lot of what our mental health providers were doing as well. So we tried to bring those services together. So this week, in this theme, as we celebrate, our goal is to always try to, as in most of the prevention work, is trying to pretty much like in the faith. You try to help and save one person from being addicted. And we can find those persons through various avenues that you started speaking of earlier, within our schools, within our communities, our businesses. We work hand in hand with 13 different sectors in prevention where we address all of the services to try to meet the needs of whatever type of organization you are in the community throughout our general population. But overall, each day there is a theme that we talk about in National Prevention Week. So we started off with our first day where we talked about promoting mental health and wellness. That was on Monday. And then Tuesday, there's the dual things that we addressed through our prevention efforts, and that was prevention of underage drinking and alcohol misuse. We do know that with COVID and all that, even though it states that we have come, we are going to be transitioning out of that. I know that it's ever present. I just received a notification of someone close to me that had contracted it, because we are gracefully coming out, but not all safely coming out, I should say. But that is a part of our prevention work, that we saw numbers rising and children being exposed to alcohol. Also, and part of our celebrations throughout each day, yesterday was also Fentanyl Awareness Day. I don't know if you've heard about the efforts of what that has been doing to our communities across Wayne County and the nation. So we are always trying to make sure we help and encourage or educate our communities on what that is doing or what detrimental effects it will have. And today's message pretty much kind of linked with that fentanyl awareness work, but today was prevention of prescription and opioid drug misuse.
Wow.
And so because we all have either had gone to the dentist and been given a prescription, and we talk about how much we are educating our communities around what's available to help prevent overdoses. We also talk about how to help persons get trained to make sure that they are, if your name is on the bottle, if your name is not on a bottle, through some of the models that we've heard from many of our youth and our communities of prevention and their work, that they have placed out messages that tell our communities, if your name is not on a bottle, it's not meant for you to swallow. And we want you to use it wisely. We don't want you to take more than what you're prescribed to take. And we're looking at all ages. We're not just talking about our young people. We work hand in hand with our adults, our older adult communities, our seniors. You know, we address from birth all the way to death. So we want to make sure we educate on each one of those areas. And I stress that more today, because we do know we all have prescriptions, and sometimes we take them correctly and sometimes we don't.
Well, let me pause you there for a second, because what I wanted to invite our audience, because this is a great conversation, right? Because when you talk about substance abuse and when you talk about mental health, it has stigmas around it, correct? And so what we want to do is kind of help give a more positive reframe to it. And I think that positive reframe is really about well-being. Right? It's all about wellness, correct? And so what I want to do, invite our guests. If you're listening to us, please call in at 313-355-6018. This is a much needed topic, because if you're not doing it, somebody in your family is doing it, okay? Someone, and I love what you said, from zero all the way up to, I want to say 99, okay? All the way up. Because, you know, and I'm going to ask you for a brief moment, how does that impact zero?
Right.
Yes.
So we do know that sometimes in the birthing of your children, and there is a lot of misuse of drugs. And so we look at trying to help the parent that is, or the mother that is carrying the child, before, as they come into this world, what are they being interacted with? We know secondhand tobacco is a big factor. We also talk about in our work through the efforts that we've been doing with various health and wellness, as you mentioned, is to prevent, to educate our communities on what's safe, to have our babies sleeping safely without
Okay.
things around them as well. So that is a
Yes.
part of the efforts that we've been doing through prevention, and many of our collaborative efforts, as well as our providers, are working hand in hand with the health department on
Okay.
those initiatives. And we talk about, as you said, birth, because it's certain things can be laced in the things that they are intaking, that they're taking from zero. So it could have come through from birth, and is also as part of secondhand. What are they putting in the systems as they're breastfeeding, or as they're
Mm-hmm.
placing as their bottles? What is around them that
Mm.
is environmentally safe and or not safe for them to be affected? So that's why we are helping those from that age. And there's medications for those as zero and up as well. If they had early arrivals or problems with pregnancies, sometimes they result. We've had a lot of cases around fetal alcohol and drinking and
Yes.
smoking while they're pregnant. So you have to address all of those areas when it comes to substance abuse, mental health, and marijuana, because we know that that is also, it's a tobacco, and it's affecting them mentally, physically, emotionally, all of the areas that we are even going to be. I'll talk a little bit more about it in the future on our wellness, on what we're doing with our Wellness Beyond the Walls efforts through our
No, I
faith.
love that wellness beyond the wall. And so earlier you mentioned youth, right? And just understanding that those numbers have increased.
Yes.
And a lot of our youth are getting addicted to fentanyl, or they're dying
Yes.
from it.
Yes.
As a matter of fact, a cousin of mine just lost his niece because of an overdose, and not really realizing that I think it was and I don't want to misquote, that the marijuana was laced, I believe, with fentanyl. So, why don't you talk to us a little bit about that? Because, when we think about prevention, I'm so happy you brought up some other things like the environment, what's around the child.
Yes.
Tell us more about how it's impacting our youth, and if you know how those statistics have increased.
Yes, they have increased tremendously with the marijuana, the dispensaries that you see popping up in our communities,
Mm-hmm.
the availability of it, and then even the when you mentioned, and I'm so sorry to hear about the loss, but if you know there are what is at available use is a lot of times persons are not caring about what is going to happen to you as a result. There is more misuse and abuse around our youth, that is because of peer pressure from various different reasons. As I stated, just the availability of the product. So we've been going in to many of our schools talking
That's
about the
awesome.
vaping, about what's, to be educated on. A lot of those devices are also taking our youth, affecting them and their systems, and not realizing about the lungs that they're collapsing too as a result
Mm.
of the vaping. And that's been also laced with different things, like you mentioned with the fentanyl. We noticed that is, many of the medications look like there is something that is real. Like if you compared or see in some of our data that we received and shared across from the United States, they showed us that the medications look identical to what a regular prescription should take, but it's been laced with the fentanyl. Or carfentanil has also been one of the other drugs that we educate our communities on about, to look out for as well. That is supposed to be used for mammal-sized persons, or excuse me, animals, and that it's a tranquilizer. Um, we do
Wow.
know that in hospitals, their fentanyl has been used as during surgeries, but it's
In a
given
controlled
controlled
environment.
environment, and
Yes.
given safely through using an IV or some sort. So there has been a lot of what we've been trying to do in educating our schools, our communities, various areas where we have been giving presentations on what to look for,
Yeah.
how to identify some things, because there are a lot of things that are hidden in the ways that you can pick up a gummy bear and think that that is safe for you to chew, but it has been laced with marijuana. So
That is really sad, and our children don't really understand
yes,
what they've been exposed to, and so it's just not in the African American community; it's
that's
in
right.
all
All
communities,
communities.
and so it's really great to hear you going into the schools and providing that education. Are you having an impact?
Yes, we've been seeing a great number of impact through our prevention providers have been asked to go in, as I mentioned. Some of our schools across Wayne County have been seeing, as you mentioned, the numbers of them, the youth, as well as those who are educating our youth, finding that, oh my God, I didn't know this, what we should be looking for. Or
Okay.
so the responses in those trainings, as well as those rallies that are happening at the schools, they are increased to be asked more of us to come out to talk to all grades. So not, may have started off with the sixth grade up to the, middle schoolers only. But our babies at as young as 9, we've been seeing their
Wow.
miss, just having accessibility to it, and just their peers or their brothers or sisters or loved ones in their homes are has it available. So we talk about those things. So we have seen a decrease in its use, but I don't have any numbers to just specifically share for you right now. But I
Okay.
would be happy to have follow up with some information for our communities on what we are seeing, identifying numbers, because we've been talking about it and educating it. That's the key.
That is great. So, just one more age group, thinking
Mm-hmm.
about the generations, we
Yes.
did the zero, we did the adolescents,
Yes.
but our older adults, please
Yes.
tell me how it's impacting and, and what are we seeing even in our elderly?
Yes. That's why I mentioned that we do address and target all ages. We even had an older adult work group that we have been working with the state on, to address what to look for. Where are the resources? Where are things that they can go to? Because a lot of times there is not the support or the help for our older adult communities to have a place to go to, or loved ones that are available to help take care of them. So we've been providing trainings to our senior citizen homes or places as
Wow.
well. So we go in to
Really?
do our Narcan trainings, which I didn't get to briefly just talk about yet, but that is one of the areas, because they have a lot of medications a lot of times that they are taking or sharing, or mismanagement of taking those medications.
Yes, if you don't have your
If
name
you
on the
don't have it,
bottle,
it's not meant for you to
it's
swallow.
not
That's
meant
fine.
for you to
I'm
swallow.
glad you got it. And so we go into the senior citizen facilities, or go to places where they are, as well as you said, older adults, and talk to them about what to not to do. How are you tracking your time? I took my medication at 4 o'clock. I'm not supposed to take it again till 4 hours later, but I
Wow.
took it too soon. So we try to educate them on that and what's available. We do have the training for our Narcan, which is also known as naloxone, that we go in to provide to help all our communities from 5 up is what our goal is in training those ages, to
Wow.
help
So
people to
young.
be prepared to try to save a life. We've been looking at different items like the fentanyl strips that we give out with the Narcan as well. The Narcan is a nasal spray that helps reverse an overdose. That we
Okay.
do have to make sure that every person in Wayne County has a kit. Across the nation, though, that is being available. It's like a first aid kit to make sure you have it at hand. So we have
Wow.
them in our
Okay.
cars, in our backpacks, wherever you are, because you never know when you're going to be faced with a situation where you'll have to help to save that life.
Let me just pause you right there. So, community, we want to invite you on this discussion. Did you hear that? Every person in Wayne County needs to have a Narcan kit.
That's right.
And if you don't have your kit, we want to hear from you. Call us at 313-355-6018. This is National Prevention Week.
Yes, it is.
Prevention cross everyone's life. And we all need mental wellness and mental health. Even talking about the suicide rate, right? Going up with drugs. Now, one of the groups we really didn't talk about, and I don't want to forget them, is our young adults, right?
Right.
And so the impact and the suicide rate going up. Tell us more about that, Kyra, because I know
Yes.
you have experience even in that area. I mean, I just can't imagine, just looking over your resume, how much prevention truly touch our lives.
That's right. Everything is just like I said. An ounce of prevention is worth a pound of cure is our goal through the work. So this work is never, however how young or old, but our 18 to 35 in that group
Okay.
is somewhere where we talk about, and it used to be 25, but it kind of expanded
Is
because
that right?
you have those that are still young adults in that age range that are
Okay.
just not really thinking about what is going to affect those of their loved ones. And as you said, we did see or experience just I think pre-COVID experience even in our church a suicide
Oh,
that
wow.
was from a young adult. I think he was in his he was getting ready to graduate, 17 or 18, getting ready to graduate. And
Mm.
when you talk about things coming close to you and what we have available, of course, our programs that we offer through Detroit Wayne Integrated Health Network, we do have a suicide prevention coalition, and we do also work hand in hand with the suicide programs that are some that are prevention providers also partner with our Detroit Wayne mental health providers in doing the suicide prevention efforts. We've been pushing that 988 number to help people
Yes.
to call and talk about how to prevent. But any and every resource that I'm sharing, of course, we also have a hotline for you all to be able to call into, which is 1-800-241-4949. I'll say it again, 1-800-241-4949 for any of our Detroit Wayne Integrated Health Services for our substance use disorder information. So I want to make sure, even with those numbers, we have different departments that address and talk about how to, what programs, the QPR, which is question, uh, persuade. I'm going to try to remember what the R is, but that our QPR trainings are available. We are offering a multitude of trainings to try to equip our leaders, whether they are leaders of organizations or faith leaders, to make sure that they are equipped to address these
Yeah,
areas.
let me pause you there for a second because I think the fact that they have made the suicide hotline crisis number shortened, I
Yes.
think is great. 988. Again, community, we want to hear from you. Give us a call at 313-355-6018. Are you struggling in mental wellness? Are you struggling and trying to be healthier, but you're finding yourself lost or finding yourself dealing with so many things that you don't really know how to seek prevention? We want to invite you to call 1-800-241-4949, as Kyra said. You matter to us. And let us know what's on your mind. What's on your mind about this topic? What do you want to ask Kyra today? Today, we're talking about celebrating possibilities of National Prevention Week from May 7th through May 13th. And if
Yes.
you can just tell us again, Kyra, what today is about, because you said each
Right.
day was a theme.
That's right. Today we're covering prescription drug, promoting prevention of prescription drugs and opioid overdoses, and drug misuse. So I want to make sure that you all are aware that we do have educational persons in our work that go out through our coalitions.
Mm-hmm.
I want to highlight just a couple today, as I told them that I would be. They working with not just seniors, but seniors meaning our older adult communities, but working with the youth. The seniors in one of the coalition communities had the youth wear the shirts. They all were trained and received Narcan kits. This is in our Hamtramck high schoolers. I'm going to give a quick plug for them.
Okay.
They have the shirts that says for them to have Narcan. Um, Narcan is what they're carrying on with them. As the graduating seniors, they had to be trained
Oh.
in order to graduate, so that you knew that the schools were welcoming and getting them to wear their gear and have them as the seniors of that high school be the peer leaders of those that's
Wow.
following.
Sound like such a big responsibility,
It does.
Cara.
It does. But that's the goal, to have our youth, because that voice is a lot sometimes stronger than the voice of you or I or our older adults, and telling them, you got to get this or you got to help this person. But when you hear it from a youth and telling them what it is that they are doing that's going to help the community and help to save lives and prevent this drug overdoses, that is one of the things that I'm grateful to see that they've been out doing, raising awareness across the communities. One of the other coalitions, I also mentioned that it's working with the east side of Detroit. Is
Okay.
also,
East side?
right,
I'm from east side.
well, I'm a west side girl.
All right.
I support all of our programs, but I would like to add that they also are providing opioid prevention packages for youth as well in the communities. They're going into the churches, and they're also getting information out. And they gave a slogan today as well that I thought was very phenomenal for them to use to promote this prevention of of these opioids, because we're doing it all. We're working hand in hand, making sure the illicit drug misuse. And as I was building upon the days that we are addressed this week, but there are still a few more days of what we're going to be promoting as well. So I encourage you to check out our website to see with all the work that our programs are doing, as well as what we try to do on a daily basis is put out what our communities and collaboratives and coalition communities are doing, as well as our clergy and our faith communities, because they see all of these areas that they have to deal with those in their congregations that may be affected by the substances or the mental health challenges.
Well, you're bringing that up. So, what are the major accomplishments and successes that you have seen this past year?
Well, it's been a lot because of our work in addressing prevention efforts. Includes alcohol prevention, tobacco prevention. It includes under other drugs umbrella. We address, of course, the marijuana. We address the prescription drugs, if you've been hearing me mention, the misuse, and you talked about suicide, because that is one of the days that we address. But the tobacco work, we do a lot of work with our messaging that we just been talking with our city council for. This past 2 days, we have been talking with our Detroit Wayne Tobacco Free Coalition has gone down to our council's office and had to try to help keep our kids off tobacco. And tobacco is not just the cigarette or smoking, but the tobacco is still the misuse of drug, meaning the marijuana, that is you smoking it as well. Anything device that you are able to smoke. We want to get it out of the hands of our youth as well.
That's really important.
And any person at this point, excuse me.
Yeah.
But we wanted to acknowledge the things that they went to get they were able to pass the big tobacco laws with our council this week, and we went out in great numbers. Excuse me.
I had some water. Let's see. There you go.
I knew I was going to have to go.
That's okay. You know what? While you going, just let you drink your water. Again, community, we invite you to call in to 313-355-6018. And I have a question for you. How do you feel about the young people having Narcan in order to make sure that they can reverse someone who is having an overdose reaction. How do you feel about that? It's kind of scary to me. We putting these narcanes in our youth hand. Call in at 313-355-6018. How do you feel about what's going on? Do you feel that our politicians are handling this right? Do you really feel that the faith community is actually doing something about it, or they're just preaching and talking about it? We want to hear from you. Give us a call at 313-355-6018. All right,
Thank
Gara.
you so much. I just wanted to make you aware of so many great things that we are doing across our region. Some of the great successes that our communities have been doing as well. Through each month, we have an awareness month.
Okay.
And we talk about what are those efforts. So starting in January is human trafficking. We talk about
Yes.
raising awareness around those areas of what you see. So you have various of our communities to address how to look for those different signs. We have presenters that come in and talk to us about how to address that in the beginning of the year. Just
Okay.
in preparing for the year, you we try to start off the year on course on health and wellness again, and so
Okay.
we've been promoting various efforts throughout each month. So each month, February is Heart Health Month. We do efforts
Oh,
around that.
wow.
So we
Okay.
just build upon each month. So March is Parenting Awareness Month. Every program is doing some services that connect to help those having parent groups sessions, and we offer various curriculums. We go into the allow those programs as well to come to either the community centers. They've been doing a lot virtually. We know Zoom is the way that with telehealth services had begun a few years back. So we do offer our services for persons who can't come out to be available to have them done virtually through the Zoom platforms or various
Oh,
social
wow.
media
Okay.
platforms. And so we talk about strengthening that family, to talk to them about the various drugs, to what to look for, to also help to keep families, bringing them back together as well. But each month, so as I stopped in March, but April we just got out of doing Alcohol Awareness Month. It
Okay.
was the month of the child abuse, where we do pinwheels for prevention. So there's
Mm.
many areas each month where we raise awareness around the efforts of mental health and substance use disorder. This month we have a multitude of things because it is Mental Health Awareness Month.
Yes.
We've had our World Asthma Day. We started out with that at the beginning of the month. National Day of Prayer. You know, we
Yes.
had to, even in our communities, we're trying to address bringing that back into our schools,
All
because
right.
we've been talking about that at our faith-based meetings
Yes.
each month on things that just were helpful to us as we grew up.
Yes.
What kept you to prevent? What are things that allow you to help you to maintain your? You can't tell me to prevent if I'm not an example of that. So I'm hoping that
Yes.
what our work and what we do is a light to show for others of how have been effective for us. As you mentioned, also this is the week for Prevention Week. There's
Yes.
also Teen Pregnancy Prevention Week. There's many efforts. Our Children's Mental Health Awareness Day was this past Saturday.
I want
Um,
to stop you just on one, because you mentioned teen
yes,
aware. Say that again. What was
Teen
it?
Pregnancy Prevention.
Uh,
We we
so
just
what are you finding in that group?
yes,
Yeah, what are some things in our teams? Because I understand the mortality rate
yes.
has increased significantly.
There has been some numbers, high numbers in infant mortality rates. And working with the health departments, we've been seeing ways to try to help diminish that. And a lot of the numbers in Detroit have been high and
Yes.
they're not always reported, as we've been finding throughout some of the deaths that had happened as a result.
Mm.
But our numbers, even for our teen pregnancies, hasn't been gratefully as high as
Mm-hmm.
we would normally see. I know that we used to have schools that were even available for those teens or youth that were
Okay.
pregnant, and I know it's not as many available. Now, I've seen them in our outlying areas where they can bring their babies to school with them, but there's not in our, of course, inner city Detroit specific area. I think those schools that were once available have combined or
Okay.
collaborated with other schools
Okay.
in the Detroit public school system. But I know the numbers for those infant mortality rates have increased more so for our older areas, our young adults. And we're not seeing
Okay.
as many teen pregnancies as we had, over
Okay.
the years. So I'll have to say I haven't gotten a lot of data on seeing that number being as high, but it's still, we're raising awareness around it.
That's great. Okay. All right. So go ahead.
That's all right. I just
Okay.
wanted to say also, just as I mentioned, Children's Mental Health Awareness Month week, day was this past Saturday, and
Okay.
that was recognized through Detroit Wayne. And there is a lot of activities that our Youth United department, which has been leading the efforts in their 20 years now as a part of the Detroit Wayne work in helping the youth and children with mental health. We call them not disabilities, but dis. And I knew I was gonna try to remember
Developmental.
developmental disabilities, but we found a way to say that in a much better
Okay.
way.
In a positive
way.
way.
So,
Okay.
and that's
All
the
right.
goal behind the work. So we don't want to put, different negative language
Yes.
on this
Yes.
dis-ease, because that's what it is. But we also realize that we all have some type of mental health
That's right.
efforts, are dealing with it in different ways.
Right.
Especially during these past 3 years, we know that we've all had to deal with
Yes.
it in some way.
Yes.
There's also Foster Care Awareness Month. That's what this is as well. And we know
Wow.
that those numbers are also, we see, and have firsthand been working with people who are doing programs just specifically for that group, helping those communities. So just keep in mind that we try not to have any person, wherever the need is, for them to be something available for each one of them.
Okay. And so what we want to do is invite you to call 1-800-241-4949
That's
and
right.
find out more about the initiatives and efforts that the Detroit Wayne Integrated Health Network is doing. Again, I have our guest, Cara Thomas, who is the regional manager
For
prevention.
Yes.
And I also read, and I want to move on to the other months that are coming up, because the summer is coming up. But I did want to touch on gambling.
Yes.
You want to talk a little bit about that?
That's right. In March we also promote problem gambling awareness in the month of March. But throughout the year we have 3 providers that's for our prevention efforts. We also have treatment providers that are doing gambling efforts as well.
Okay.
But we have been trying to utilize in the schools, we do a curriculum called Stack Deck that our providers use with the youth and some with churches as well, to talk about how to prevent those gaming systems and things that that have been drawing our communities as well as us. If you have if you're on, have a phone sometimes, or in your mail, or you're hearing those commercials that are really popping up, we're trying to be the voice to prevent some of those messages from overtaking our communities. And so we do for every person, not just our youth, but our focus has been with some through our stack deck with schools, but also we have coalitions that work hand in hand with the communities to address what social media is pushing out. Those efforts and giving messages to talk about what happens with your finances when you're gambling, and what happens, how it affects your family members as well.
I think this is so important. And I want to invite you, community, to call 313-355-6018. One of the things that I am clearly aware of, that there are resources out there that we are not finding out about. I want to encourage you, don't sit back. You know, one of the things that I do when I exercise, and I exercise with video, and the person I exercise with on the video says, don't sit on that sofa, okay? Don't sit back eating ice cream and doing food and knowing that you need to get up and move. Do not sit back and listen to this program knowing that you need information. So give us a call at 313-355-6018. Speak with our guest today, Kyra Thomas, on all these prevention areas, all these resources. And I do want to ask you, Kyra, are you collaborating? Because collaboration is power.
Yes,
are you
it is.
Collaborating with other counties?
Yes, we do, and it is encouraged through Detroit Wayne that we are even building upon like a tri-county work and effort. We do a lot of hand in hand with, because we border so many different areas.
Yes.
We have Oakland County and Macomb County that's on our, that we joined efforts with, and we also share some providers across the counties as well that do receive resources, allocations, in a sense, for services to do prevention as treatment and recovery services, that they can do them, that we share, as I stated, providers that do some services in their area, but also service our communities as well.
Is that right?
So,
Okay.
So we do collaborate, and we actually have had a couple of, I believe, events of successes that we've done together. That's even like-minded ones that were done, like the ACES conference that was done in Oakland before, and now we were able to do it in Detroit this time. And so we do work hand in hand on various different efforts. And as I mentioned, the tri-county meetings happen that we do through Detroit Wayne to talk about what we're trying to collectively do together and to reach up to what our state work is for our statewide efforts. Because we all in prevention have to follow the required, I should say, things that are the priority areas for us. That would include addressing the things that we're doing throughout this week. We all have to match that as well. Even with the Narcan kits, even with if they call the 800 number and they don't live in our area, we have to be able to refer the person to match up that person for them in that
That's
area.
great. So am I understanding it is a countywide effort?
That's right. It's countywide, and as well tri-counties that we work hand in hand with, as well as always we look at tools of what is another community doing that's been successful that we may be able to initiate in our community. So we're always looking at ways for improvement, of course, as well.
Well, tell me, what are some of the barriers, challenges that you have found in doing this prevention work?
Well, I don't see as many. I think it's been because of COVID. That was one of the areas where people weren't actually able to be in person with one another.
Mm-hmm.
That was a big piece as now we're beginning to transition back into safely. We couldn't get that audience to be there because you weren't able to be able to touch our numbers. We've been able to maintain some pretty good numbers, but we do realize that that was one of our barriers of not being face-to-face with our communities as we were having to learn to adjust to this telehealth work, and just making sure that we are meeting, because we can't see what's happening behind the walls of those communities that normally we would see in persons like you and I that are we have good strong faith. We seeing that our leaders are taking the cloths off. We talked about that in our faith-based meetings, that they don't want to do they don't want to have to speak to the communities as much before. Some of them have completed suicide as well. We've heard many stories. I stated that one of the ministers I had talked with about presenting told me he did 65 funerals. And I was kind of amazed by the numbers that we see that has been that has been what I think has been the weight for our communities, just having to mourn so much with no
Yes.
matter what age, we know what happens with what's happening with the schools, just the transition of our kids going from being taught from home, going back into the schools,
Yes.
and how they are adjusting safely there. So those are some of the barriers that
Yes.
we have tried to even work with our communities on to help take in our programs where they may not have been in the school, but in uh, starting those collaborations. We have seen programs that collaborated that hadn't done before,
Okay.
that are helping, like some of our teen girls that when you mentioned earlier about the pregnancies, and I'm so happy to say in one of the programs that are partnered with our communities, the program is called Full and Fabulous, and the girls they go through with our programs in partnership with a couple of our providers to do strengthening families. I mentioned the evidence-based models. They're also doing, positive efforts to go back and volunteer and give to different events now that we're able to be out.
Yeah.
So those barriers we have been addressing,
Mm-hmm.
but we realize they are they are there, and we ask, what is it that, how may we be able to help? Start to think about, ways of keeping or maintaining those in our programs. We had a lot of turnovers happen with staff. That has
Yes.
just been people, I'm like, how are they maintaining their lifestyle without working? A lot of them started their businesses, own businesses, or
Yes.
doing ways, social media is the way that a lot of people were able to start their own organizations or start doing their own businesses. So it
Okay.
has its disadvantages, but advantages for them. So
Yeah, you're right about that. A lot of change happened post COVID, during
yes,
COVID,
yes.
and I felt like you, like, where are people going?
Right,
All these jobs that are out here, what is
right,
happening?
exactly.
But a lot of people did start their business. I actually started mine in 2019, so I know
Right
what
on
that
time.
looked like and feel like. But here we move right into 2020, and I found for my business that I was blessed because unfortunately mental health went up. So I had an opportunity to help because I'm a licensed professional counselor. That is that is one of the trades that I do. So in that, I wanted to make sure that we talked about what's happening in June. Like, what are some things that are upcoming that you would like for us to know? June, July, August, September, October.
That's right.
Moving on, that we need to know about. And again, community, we are winding down, and I just want to make sure that we invite you to call 313-355-6018. This is a much needed topic. We have our guest with us, Cara Thomas, and she is talking about prevention. And we all know the importance of mental wellness and mental health. So give us a call.
I am so surprised all of those lovely callers out there haven't blown this phone lines up.
I know.
But I encourage you as well, if you still are hanging in there with us, and I'm thankful to be able to talk about all of the things that we are doing that has
Yes.
been prevention is never sleeps, they say, in a sense that we are always working. We know for June though, and I didn't want to let you get away from the last 2 days of this
Good.
prevention week
Okay.
before we talk about
Okay,
what's coming
great.
up in those coming months. But for the Thursday, May the 11th, prevention of illicit drug use and youth marijuana. We've talked about how we're
Yes.
going to be addressing that. Different creative ways that we're trying to even talk about how to look for it, where you can go in to where those places are and tell them, don't sell to my youth, or don't let me, don't bring this stuff around me. You have to be the voice. May the 12th is prevention of suicide, and we will
Okay.
be continuing to push that number 988 out. But we have programs that are always addressing how to get trained on the signs, what to look for. And
Let
also,
me stop you right there for a second because you talked about training a lot
yes,
and you talked about leaders. And one of the things I want our community to know that leadership is really about influence. It really is. And so we influence the behavior and actions of others by what you said, by how we act
that's
and
right.
how we talk and how we walk in our communities. You know, it used to be a saying, do as I say, not as I do, but that's a lie. We need to say and do. So I want to encourage you callers to call in to 313-355-6018 and let us hear from you about how you are leading in your community. Go ahead, Kyra.
Thank you very much. So that will end, the ending of this week will be the prevention of youth tobacco use. But like I said earlier, we've been promoting it all throughout the year, throughout the month. We are actually going to even be doing with our faith organizations No Menthol Sunday. It doesn't have to just be on that Sunday, May 21st, because we're doing some events around the year for that. Excuse me.
That's wonderful.
I just tickled in my throat here.
There's the water.
I know.
Okay.
Sorry.
That's okay. Again, let us hear from you. We are winding down. Please give us a call at 313-355-6018. I also want to encourage you to call 1-800-241 4949 for
Yes.
further information. And if you know someone that's contemplating suicide, need to talk because a lot of loneliness has happened post COVID. We want to encourage you to call 988.
Yes, right. You want you to do that. Please do. We also know that the line that she did give you out, in addition to that 1-800 line, many of our communities, Wayne County has Healthy Communities line. They can also go to the website for WayneCountyHealthy.com.
Okay.
Our crisis line, you've been giving that out. It's available 24 hours a day. We have many resources around what this prescription drug work is doing. A lot of people had questions to ask, what is happening with the opioid settlement, and what's happening with the different dollars even that's out in our communities available.
Yes.
We also want to tell you just for June, July, and August. So in June, we do promote the awareness of we know celebrations happen. A lot of people are graduating, prom season and graduations, as I said, happen. But there is also the Pride Month, where our youth, where not just youth, but communities where we celebrate the LGBT community. So we have to make sure we meet the needs of all and help all of those in our communities to talk about still preventing, still knowing those services are available. In July, Awareness Month, off the top of my head, it's a lot of things happening throughout the summer months that we participate in, that we share, and we have the summer camps that happen. A lot of those things will start building up for our youth as well, and communities, just to be engaged with one another. And then that month will also be our opioid summit that we're hosting at July the 25th at the Laurel Manor in Livonia. So please register for that. The Opioid Summit is our 7th annual one. That will be July the 25th at Laurel Manor from 8 to 4.
And let's get one more in because we got to wrap it up.
And on August the 6th, August 17th and 18th, as many of you may or may not know, our Wellness Beyond the Walls 9th annual faith-based Wellness Beyond the Walls, You Are Not Forgotten conference will be held in the month of August. Please sign up for all of these conferences. You can go to our website at www.dwihn.org to find out more information. We do also have that training link that you mentioned, which is www.dwctraining.com. You can register there for any of the trainings that we offer through Detroit Wayne as well. And we will always have a link available for our communities when we do our faith community ones.
That's great. And so, what's the number that they can call to find out all about this information?
Is 1-800-241-4949.
So I want to thank you, Kara, for being with us today on Enlightened Hearts and Community Updates. You can join us on Twitter, Twit, Facebook, and YouTube. To find out more about us, please feel free to call 313-355-6018. Again, we send in prayers to Michelle White, Community Updates. I am Regina Hall, your host of Enlightened Hearts. Thank you so much for joining us, and you have a